Hello and welcome to NHIS in a week. We bring you highlights of events within the authority and the scheme. My name is Vida Edichumwa Boateng. Now the headlines. A delegation from Tanzania Insurance Regulatory Authority pays working visits to the NHIA. NHIA embarks on corporate special registrations. Now the details. An 11-member delegation from the Tanzania Insurance Regulatory Authority, TIRA, has paid a working visit to the National Health Insurance Authority. Aside reps from TIRA, the delegation was also made up of some MPs from the Tanzanian Parliament. The visit was to learn at first hand the operational strategies and regulations employed by the authority in the management and sustenance of the scheme.
We are here to actually learn on universal health services that Ghana are providing to citizens, as we are currently having a bill before Parliament that actually seeing how we can cover all Tanzanians with health insurance.
The leader of the delegation, Mr. Bagayo Sakwa, who is the commissioner for the Tanzania Insurance Regulatory Authority, praised the NHIA for the level of success that Ghana has achieved with the National Health Insurance Scheme.
So our visit and choice of Ghana to get a learning curve was the right choice, and our tour to this end, we can safely say we have achieved what we wanted. Thank you very much. As you have seen, our team comprises of people, civil servant as an executive arm, but also our parliamentary members of the parliament. Members of the parliament, they assist and manage the executive arm. So we have learned and we get a common understanding of what you have. It is true also that Africa insurance sector has some commonalities. Even health system also has some commonalities. One of that commonalities is penetration. We are struggling to get people to join the insurance system as a system of managing risks, including health risks. For example, in Tanzania, the penetration is 1.68% of the GDP, which is very low compared to relatively other countries like Egypt and South Africa.
Moving on, the Corporate Affairs Directorate of the National Health Insurance Authority is on a mission to facilitate the registration of staff of corporate institutions onto the National Health Insurance Scheme. This is because making time for most corporate staff to visit the NHIS district office to register has been a challenge.
So, the National Health Insurance Authority is embarking on a corporate mass registration. The reason for this exercise is to allow corporate staff at their office space who are not able to have enough time to visit our district offices for registration. We are ever ready to visit your organization to enroll your staff onto the scheme.
The exercise began in Accra on Monday, October 24th at the premises of Interplus Ghana Limited in Accra, where many substantive workers had the opportunity to join the scheme's mass registration exercise. The Public Relations Manager of Interplus Ghana Limited, Elizabeth Owusu JB, in an interview with NHI Media Team, said this exercise was beneficial to the company staff whose busy schedule prevented them from visiting the NHI's district offices for their registration.
Call us on 0302 746447 to schedule an appointment.
I'm I would say over-impressed with the turnout, because earlier on we estimated 100 people out of our 500 staff, and it seems after the first day of the re-registration, the interest has grown more how should I say, more bigger, and a lot of people have joined in, and we've had to extend it from 1 day to 3 days. Most of our staff here, over 500 of them, use the government facility already. So we wanted to take the opportunity to encourage them and to take advantage of free consultation and free labs and all that, to also take off some of the burden from the company as well, because company currently pays all these bills for them. So if it will cost us less, we will save about 80 cedis or 30 cedis on a staff's bill. That's a good saving for over 500 staff.
As part of ensuring universal health coverage for all, the Dagme East District of the Greater Accra region embarked on a special registration exercise as a means of rapidly expanding the LEAP membership coverage in the district from the 2nd to 13th October 2022. The exercise reached out to identifiable communities under the LEAP program. The team, made up of staff from the Dagme East office and the regional office, took the registration to the doorstep of the LEAP beneficiaries. This week on Health Tip, we take a look at breast ultrasound. Up next is NHIS Titbits.
Did you know that a new member serves a waiting period of 1 month before accessing healthcare under the scheme? However, persons 70 years and above, pregnant women and children under 5 years of age do not serve any waiting period.
Get enrolled onto the scheme. NHIS, your access to healthcare.
This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh and follow us on all our social media handles for more. My name is Vida Edichumwa Boateng. Thanks for watching.